On the 17th of September 1918, the first reported cases of the Spanish flu were detected in Philadelphia. And by this time, the Spanish flu had been making its way around the world for 9 months. So when it appeared in the city, the authorities knew what they were dealing with. City leaders felt compelled to downplay the emergence of the new cases because they didn't want to implement any social distancing because in 11 days, a large citywide parade was being planned for soldiers heading off into the war. During the parade, the city also wanted to advertise war bonds to raise money for the war effort. So the parade went off as planned. And a little over 2 weeks later, on the 3rd of October, the city's healthcare system was overwhelmed and the city finally implemented strict social distancing measures. It took the Spanish flu about 2 weeks to travel 900 miles all the way to St. Louis, and by the time the first cases were reported there, St. Louis had the example of Philadelphia to learn from and immediately ordered social distancing measures. The flu hit both cities, and deaths occurred in both cities, but each city had a different story. St. Louis had half the death rate of Philadelphia because it did things differently when the disease was first detected. Now, the point of telling you this is not to give you yet another lecture about the importance of social distancing, but to make another point altogether. I want to drive home the notion that each city and each region in the COVID-19 pandemic, no matter how large or small, will end up with its own story. For example, while COVID-19 has hit Italy hard, if you look at the map of where the cases are, you see that the large majority are in Lombardy. Before Italy locked down the entire country with social distancing measures, there were cities and towns with very few cases, and these cities, while they'll still have the virus, won't suffer the same devastation as Lombardy. There'll be plenty of cities and towns in Italy where COVID-19 will have a small impact. They will not share the story of Lombardy. So while overall any particular country might get hit hard, that doesn't have to be the case for any particular city. Each city will have its own story, and local city officials have tremendous influence in shaping that story. South Korea and China are the only two large countries that have successfully managed not just to flatten the curve, but begin to bend it downwards. They have some critically important lessons to teach us the governments, local and national, can deploy. Right now, the conversation you hear everywhere on the news and in social media is about masks and ventilators. These are important conversations, and they need to continue. But there are two other elements to the response that we are not thinking about enough.
Well, first of all, testing is central because that leads to early detection. It minimizes further spread, and it quickly treats those found with the virus. And I think that's the key behind our very low fatality rate as well.
The first lesson is that testing capacity makes an enormous difference. Our biggest failing thus far in the United States has been a lack of widespread, easily available testing. And the gravity of this failing is underappreciated because of current CDC guidelines. These guidelines are very specific about who should be tested, and they largely boil down to patients with obvious COVID-19 symptoms. The CDC guidelines create an impression that testing anyone who doesn't have obvious COVID-19 symptoms is counterproductive or not useful. But it's important for local leaders to understand that these guidelines are shaped by a scarcity of testing kits and not because they are grounded in sound epidemiological principles. The more a population is tested, the more cases a city will be able to identify and isolate. So the aspiration should be to have extensive, easily available, widespread testing deployed at multiple sites throughout the city. So anything city officials can do to leverage more testing capacity for its population will go a long way toward shaping the story.
The testing is everything because that's how you know whether you need to do more shutdown or you're starting to get to the point where you can relieve it. Testing is the key thing. South Korea did that in this massive way that, everybody should learn from.
A local industry campaign could be mobilized to make the tests locally if possible. The city could also spend its own money or ask for donations to directly purchase the tests from other countries if need be. The more a population is tested, the better it will do. And anything local government can do to increase testing capacity will help slow the spread.
We have a simple message for all countries: test, test, test.
The second critical lesson to emulate is the establishment of quarantine centers known as fever clinics. If the first step of widespread testing is implemented and infected people are identified, the current instruction is to ask patients to quarantine themselves at home if they have mild symptoms not needing hospitalization. While there may be some people that can do this effectively without exposing themselves to their families or to the public, the fact of the matter is that these people are still out there in the community and most will still interact with it, even if they don't want to. If they don't have a roommate or family members to infect, they will still need to go outside to the grocery store or to a pharmacy to get medications for themselves. The chances are, even if they're told to self-quarantine and not interact with other people, their circumstances might not allow them to. Local government can make a critical difference here by providing a structure of assisted quarantine to these people. They can use hotels or makeshift centers out of churches or schools or dormitories. The city can bring food to them so that there's no reason for them to go out. Their quarantine will be further assisted by having healthcare workers like doctors and nurses at these centers so that patients can be checked on 2 or 3 times a day to make sure their symptoms are not progressing. For those patients who don't want to go to a center or hotel, they can choose to stay at home, and assisted quarantine would involve local volunteers bringing them food and supplies. However it's done, it is critical for them to be isolated from the general community and for then that community to care for them so they can stay isolated. South Korea and China recognize the need for this, and both countries established quarantine centers. Regular, constant access to healthcare staff at these centers allowed for quick identification and treatment of patients who are getting worse so they could be transported to the hospital. South Korea categorized patients into 4 groups: asymptomatic, mild, severe, and critical. Only the severe and critical patients were hospitalized. Using their criteria for admission, the Koreans found that only 10% of infected patients needed treatment at a fully equipped hospital, while the rest of the patients could be safely supervised by healthcare workers in quarantine centers. This maneuver increased healthcare capacity tremendously, a measure that has an important impact on the mortality rate. The current paradigm of social distancing seeks to flatten the curve. But the fact of the matter is that if this is done successfully, it will require strict social distancing to remain in place for months on end. Not only will compliance start to waver as the weeks roll by, but it will also have the inevitable effect of destroying the local economy. There is a Faustian trade-off between mortality rates and economic recession. With the combined approach of widespread testing, contact tracing, and assisted quarantine measures, the curve can be smashed, not just flattened, as they did in South Korea and China. The quicker local governments act, the higher the chances are that this is possible, because there comes a time when there are simply too many cases in the community for quarantine support mechanisms to be viable. If the curve can be decelerated downwards, as they have done in South Korea, the draconian measures of social distancing can be lifted a lot sooner, and businesses in the city can return to normal a lot sooner. If we know who in the city is sick and who their close contacts were before they were diagnosed, we can identify all of the at-risk people and isolate them for 2 weeks from the general community, allowing the rest of the population to carry out normal day-to-day activity. These measures are not easy, but they can still be undertaken at the local level, and a city that enacts them will be able to write its own story in this pandemic.